So we are at the governor's second summit on mental health, and I'm talking to
Stephen Johansson. I'm the director for the Wyoming Department of Health.
Tell us why this is so needed and what the second year brings to this question.
I think you can't have a conversation about health or healthcare these days without talking about behavioral health or mental health. I think one of the purposes of this summit and the last summit is to illuminate some of the state efforts that are going on in the behavioral health or mental health world, recognize those, but also identify where we need to make additional investments, where our gaps and our issues are, especially as it relates to populations that are very high needs, that end up in our legal systems, in our correctional institutions, our jails, and our children in schools, that we're seeing more and more behavioral health issues. So really twofold: illuminate what's being invested in and get that awareness out of what the state is doing, but also bring community partners to the table to point out what they're doing, where they're innovating in their communities, and how the state can help sustain and support those efforts.
That's a lot.
It's a lot.
And it's challenging in a state that is very cost conscious. I'm tiptoeing around it, but how do we do it?
Well, there's no easy solution, but I think from my perspective, we know we live in a resource-constrained environment in Wyoming. Even more so, we have a very small population and a huge geography. So a lot of our issues in healthcare and health and human services are problems of scale. Where there's room for optimism is groups like this that come together. And over the years, we've seen the legislature participate in groups like this and recognize those challenges, but also come up with concrete solutions of how we can invest in and improve state systems. So with those cost issues and with those scale issues geographically, Wyoming's really in a unique position because we can aim really big and we can miss really small. The beauty of this state and conferences or summits like this is that it's not rare to talk to an agency director, governor's staff, legislative leadership just at the table here and hear that feedback and those solutions. So Wyoming can be quick to implement much needed help in this behavioral health space.
Give me something that gives us hope on this.
Something that gives me hope is the people of Wyoming are absolutely resilient. And even in some of these really challenging environments, like the facilities that I oversee, the state hospital, our local and statewide corrections facilities, our Department of Family Services system, as challenging as some of those circumstances are for the people we serve, and really tough lives, I see the resiliency in those folks, and that's at the heart of it. All of this complexity about the system and the funding and the coverages and how we solve these policy issues, it comes down to people's lives that we're trying to improve, services that we think can help them, and at the bedrock of that is the Wyoming people are extremely, extremely resilient. So there's better times ahead, and this problem too shall pass, and we'll be better for it.
So thank you for talking with us. Appreciate that.
Thank you. Nice to meet you.